Ozempic, miracle drug or health crisis. Ozempic, semaglutide, a GLP-1 receptor agonist developed by Novo Nordisk, has garnered significant attention for its dual role in managing type 2 diabetes and promoting weight loss. As of 2025, its widespread use has sparked discussions about its benefits, risks, and broader implications for public health. Mechanism of action. Ozempic mimics the action of the glucagon-like peptide-1, GLP-1 hormone, enhancing insulin secretion, suppressing glucagon release, slowing gastric emptying, and reducing appetite. These combined effects contribute to improved glycemic control and weight reduction. Efficacy and usage trends. Weight loss. Clinical trials have demonstrated that Ozempic users can achieve an average weight loss of approximately 15% of their body weight. However, real-world data indicates that patients often experience less weight loss due to factors like lower adherence and dosage variations. Diabetes. Management. Ozempic effectively lowers HbA1c levels by an average of 1.5%, aiding many patients in reaching the target of 7% or less. Prescription rates. In the U.S., over 1 in 8 adults have used Ozempic or similar GLP-1 drugs, reflecting a significant increase in prescriptions since its approval. Health implications. Cognitive and behavioral health. Studies suggest that GLP-1 drugs like Ozempic may reduce the risk of dementia and improve behavioral health outcomes. Liver health. Research indicates that semaglutide can halt and potentially reverse non-alcoholic steatohepatitis, NASH, a severe liver disease. Addiction treatment. Preliminary studies show that Ozempic may help reduce alcohol cravings and consumption, opening avenues for treating alcohol use disorders. The surge in demand, partly driven by off-label use for weight loss, has created supply shortages. This impacts diabetic patients who rely on the medication for essential care. Access issues can disrupt treatment and health outcomes for this vulnerable group. Common side effects and risks. Gastrointestinal issues. Nausea, vomiting, diarrhea are widely reported. Hair loss. Rapid weight loss linked to thinning hair. Muscle loss. Weight loss often includes muscle mass reduction, impacting strength and metabolism. Ozempic teeth. Dry mouth and nutritional deficiencies linked to tooth decay. Vision risks. Increased risk of neovascular age-related macular degeneration, NAMD, and ischemic optic neuropathy, NAION. Mental health. Elevated reports of depression and suicidal ideation. Ongoing studies are examining these associations. A study reported a 45% higher incidence of suicidal thoughts among semaglutide users compared to other medications. This association underscores the need for vigilant mental health monitoring in patients prescribed these drugs. The cost of Ozempic is also a significant barrier for many. The cost of Ozempic poses significant barriers to access. In the U.S., the drug is priced at approximately $969 per month, compared to $155 in Canada and $59 in Germany. This disparity raises concerns about equitable access to treatment and the financial burden on patients. Without adequate insurance coverage, the price can be prohibitive, raising questions of equity and access to this potentially beneficial treatment. Demographics and accessibility. Adolescent use. The use of Ozempic among teenagers has surged, with prescriptions for those aged 12 to 17 increasing by 50% in 2024. Experts caution about the lack of long-term safety data for this age group. The widespread focus on Ozempic for weight loss raises ethical questions. Is it being used appropriately? Are the risks fully understood by those using it off-label? There are also concerns about its portrayal in media and social circles. This can create unrealistic expectations and potentially encourage inappropriate use. The long-term impact on public health and healthcare systems warrants careful consideration. The focus on a pharmaceutical solution for weight management also prompts discussion about lifestyle interventions. While medications can be powerful tools, they are often most effective when combined with diet and exercise. Research and future therapies. Cagrilintide. Combination of semaglutide and cagrilintide shows enhanced weight loss and appetite suppression. Muscle-sparing approaches. New research targets lean mass preservation alongside weight reduction. Black market and unauthorized use. The high demand and limited supply of Ozempic have led to the emergence of black markets, where counterfeit or unregulated versions of the drug are sold. In Scotland, for instance, individuals have been purchasing these illicit products, risking exposure to harmful substances and unverified dosages. Recent regulatory updates. FDA approvals. In January 2025, Ozempic approved to reduce risk of kidney failure and death in diabetics with chronic kidney disease. Compounding ban. The FDA halted off-brand semaglutide sales in May 2025 due to resolved supply issues. Ozempic is a powerful therapeutic tool with the potential to revolutionize treatment for diabetes and obesity. However, its popularity has outpaced comprehensive research on long-term outcomes, particularly in younger populations and those using it off-label. Public health experts emphasize the need for stricter regulations, improved access, and increased education to ensure safe, equitable, and effective use. Ultimately, Ozempic is a complex tool. Its role as a miracle drug or a contributor to a health crisis depends on how it is understood, prescribed, accessed, and integrated into broader healthcare strategies. A balanced, informed approach is essential,